early, but you can't go late. We're live, good homie. I love how I say we're live. And then
his video goes off.
I might or might not have had Alfredo on my face. That's all.
Okay, got it. It's all right. You know how it goes anyway. When you go live, you got to kind of give a minute for people to show up and tune in. So
yeah, so it's cool. We're going to be talking about what the Omarion, and I'm sure people are trying to figure out what that means because I didn't know it. But
I'm mad that you didn't know what it meant. Like,
yeah,
you didn't know what it meant.
No, I didn't know what the Omarion meant, and we're not going to share it. I'm sure there's somebody else who does not know what the Omarion means, and we're going to let them try to figure it out as well. So, and if you already know, don't spoil it. But what we are going to plan to do is we're going to open with some conversation to ground the conversation around the Omarion. We're going to dip into some Q&A at the very end, and we're going to try to be respectful of everyone's time and try to end this in 45 minutes. And so going to start in about 4 minutes, I'll say. It's 7:31, and try to end right at about 8:15. But there's lots of questions about this Omarion character. And we want to answer some of the questions and then maybe even answer some questions that you all might have directly about this, maybe some lived experiences, some professional experiences, or maybe some things you're wondering. So that said, I'm going to be joined by at least two amazing folks. We might have a special guest with us later, but as you all know, my favorite epidemiologist in the world, Dr. Debra Furr-Holden, is with us today. And Dr. EJ, family, I always say that you're a primary care physician, but am I right when I say that? Oh, yeah, I got it right.
You got it right.
Yeah. So, amazing primary care physician, my favorite epidemiologist in the whole wide world. We're going to answer some questions about the Omarion, or what the Omarion. So I've been looking forward to this.
Know the real name of this by the time this is done.
Yeah, that's probably true, but from what I understand, people didn't anyway, so it's fine. I mean, we're going to talk about this, like these variants. Like, I get how the names come about. I think I'm following the bouncing ball here, but it's like, man, I want to talk about variants in general. And I've got some questions. I'm sure other folks have some questions. But Dr. EJ, I'm coming for you. I need you to help me understand the world of variants and what it means and what's the difference. And I'm giving you the preview of all of these things that are in my head right now, because I'm sure if I don't know it, actually, if I don't know it, everybody else probably does know it. I'm the sincerely ignorant little brother here. But I'll ask the stupid question or the sincerely ignorant question, as you know.
We got some folks chiming in already.
They know what the Omarion is.
There are no stupid questions, right?
You know what? And I tried to change that quickly, but we are live, and so I had to make that work. But I'm hearing that someone had it in Africa. Prepare for that, Dr. EJ. I'm coming back to that. You may know, maybe able to unpack that a bit for us, but there's a lot to learn here. It's 7:33. It looks like we got some folks logging in. I'm seeing some folks on my live logging in. So hello, folks. Nice to see you all. You can talk to us in the chat. We're able to see it. So just telling us hi, let us know you're there. Let us know that your questions are coming. That'll be helpful.
Mm-hmm.
And I'm just filling the space here, just talking a little bit. What's up, JQ? What's going on? He came to learn about the Omarion too. You know, Omarion is in our time period. You know, like Omarion is in our space. It's one of our guys.
Our guys now.
Late 90s, early 2000s. He's in our Omarion, you know, the pretty Ricky time period. Like that's our time. That's not what we're talking. We're not talking music here today, but that's in that time period. So Omarion, now people really not gonna know what are they talking about right now.
I don't know if I want to claim that time if the claim to fame is Omarion and Pretty Ricky. I got
I'm just saying that it fits in that time period.
Welcome to the party, Dr. Knighton.
Hello.
So we're going to start off with big time fun here, right? So I know a couple of people. We're going to get to know over the next 40 minutes another person. And we're going to talk about what the Omarion. And it's 7:34, so we're going to jump right into this conversation. What up, Zeke, is the comment that came up. JQ is my homeboy from Flint.
I used
Um,
to hang with B2K. What do you
See?
mean? Don't tell nobody though. Like,
listen, that's not what we're talking about here today, but it sounds like that could be a whole different podcast. We're not talking about it today, though. Today we're talking about what the Omarion.
Mm-hmm.
But let's start off with a moment of just round of introductions. Just who are we? What are we doing? My name is Isaiah Oliver. I lead the local community foundation, the Community Foundation of Greater Flint. I always talk about us leading this work of engaging people in the world of giving their time, talent, and treasure. And I'm also blessed to have amazing folks who know a lot more about the Omarion than I do. And so this gift of time and talent that happens in the evenings where we get to answer folks' questions about what's going on with this virus is just literally kicking our butts, and we know it. And so if we can unpack that a little bit for folks on all of our collective listening audiences, right? That's just good time well spent. And so that said, I'm excited to be here and excited about the opportunity to engage with some amazing folks. I'm going to start with Dr. Debra. And if you, Dr. Debra, could introduce our guest, and then our guest can pass it off to Dr. EJ. How about that?
All right, cool. So I'm Debra Furr-Holden. Oh, my mic sounds bad. My mic sounds bad. Yeah. Dr. EJ, you go first.
So we're going to do an audible to start it off. We go started with Marie Joy, and then we're going to go to our guest, and then we're going to close out with Dr. Furr-Holden.
government names. All right. I am Jennifer Edwards Johnson. I'm a family physician, primary care doc, and community assistant dean of the Flint campus of Michigan State University College of Medicine. I'll pass it off to Dr. Knighton.
Hi, so I am Dr. Shanina Knighton, and I am faculty and a Caltech scholar at Bowdoin School of Nursing and an infection preventionist. An infection preventionist, oddly enough, there's only about 16,000 of us in the world. And our job is really studying the policies, guidelines, creating the policies and guidelines around new bugs that may come about, ones that may reemerge. So it's my science to actually study how do we prevent the transmission of bugs.
We are going to have an amazing time. And Dr. Debra, you got it.
All right, cool. Thanks. I'm Debra Furr-Holden, epidemiologist, and I'm the Associate Dean of Public Health Integration at Michigan State University and the Flint campus in the College of Human Medicine.
All right, so I'm going to jump right in here. And I'm echoing on my side. I don't know if I'm echoing on yours. And so I'm not anymore. Am I still echoing on yours? Okay.
Now we can't hear you.
Yeah. You're mute now.
All right, can you hear me now? Can you all say something?
Something.
All right, I can hear you all as well. But I'm echoing off of you, Dr. Debra. Yeah, I'm echoing off of you. But I'm going to jump right in here to a question to you, Doc. So I'm going to go on mute and you're going to come in. But I'm jumping right in because from what I understand, you've been very transparent about this, but I think there's some unpacking of the situation for folks to have. You contracted COVID at a wedding just recently. And so far at this wedding, at least what I hear, 15 known COVID cases came out of this wedding. And more than half of them were identified as Omicron cases. And you're pretty careful. You give me all kinds of thoughts and ideas and ways to practice and be safe in community. And somehow this happened. I want you to just talk about it. Just tell us a bit about that experience, how it happened.
Yeah, sure. I think I, like many other people, have COVID fatigue, but this was an event that was for somebody who was near and dear to me, a former student. And I was asked to be vaccinated. And if I had been out and about, recent negative COVID tests, I did both of those things. And I think most of the guests also did those things. So, that's sort of the recommendation, right? Be vaccinated, recent negative COVID test, wear your mask. So at the wedding, everybody was masked. At the reception, everybody walked in masked. But then, of course, what happens throughout the course of the reception? The food comes out. You can't eat through a mask. So masks come off so people can eat. The bar opens. People start to drink. The masks come off because you can't drink with a mask on. And then the drinks start to take hold. And then, it just goes how it goes. And then, of course, me, like a moth to a flame, when the Cupid Shuffle came on, I couldn't help it. I looked down and my feet were moving toward the dance floor. So I did spend, I would say, in all honesty, the majority of the reception, me personally, I was unmasked. And a lot of the people at the reception were in the healthcare field. And so I left the reception. In my mind, I said I left early because I did look around and I said, there's a fair number of people here and not a lot of masks at this point. So I said, you know what? I've had a great time. I'm going to leave. I did actually check my Uber, and actually I only left an hour early. So I was actually there from 5:30 p.m. till 10:30 p.m. It didn't feel like that at the time, but if I'm being honest, I was there for 5 hours, living my best life. And I came home on the next day on Sunday, and then on Monday I had literally, it was like this. It was nothing, but it was like just like a little itch in my throat. By Tuesday, it was scratchy and I was clear something was going on. At that point, I decided to wear my mask inside around the family and to go get a COVID test. And the next morning, in fact, I got a rapid test at one of our local community testing sites, and it was in fact positive. I also got a PCR test because you can get them at the same time. One is called a rapid test or antigen test. Those results are pretty good as long as you've got enough viral load. And then I got a PCR test as a backup, and that takes several days sometimes to come back, and it was positive. So I had to alert everybody that I had been around since then that I was in fact positive. My whole family had to get tested, and lo and behold, my daughter Jordan, the oldest, my granddaughter's mom, also tested positive.
Yeah, I'm trying to unmute. So Doc, how many people were at this wedding? And if at any point I'm asking too many questions, just push back and say none of your business, right? I'm going to do that. Dr. Knighton, just so you know, that's going to happen. But how many people were at this wedding?
I'm estimating, and remember, when we talk about the wedding, there's the wedding and then there's the wedding reception. When I think on the wedding, there were more people at the wedding, but the wedding was in a big church. People were kind of really spaced out. I noticed, there's like, when you go to church, you sit with your family. They were kind of sitting almost like in little pods. It's like a natural phenomenon. I don't know exactly. If I had to estimate, around 100 people maybe were at the wedding. I was at a table that normally looks like it might be a 10 or a 12 top, and there were 6 people at my table. So there was some spacing out of guests even at those tables. I don't know how many other people at the wedding have tested positive. The wedding party has decided that they want to keep all of this stuff private. That was not really an option for me because I was so excited for the person that I knew that was getting married. I shared pictures on my social media channels on that Sunday. And, people put two together. And before I knew it, I was being contacted by reporters saying, you were at the Wisconsin wedding, which they're calling a super spread event, which I think is such a mischaracterization because 100 people, when you've got arenas, full-blown arenas that are open with 20,000 people packed in, yelling and screaming at the game with no masks on. Like, yeah.
So this is probably not a fair question, but I'm gonna throw it to the you Dr. Debra, and I'm gonna talk to. I got a bug question. So Dr. Knighton, I'm coming to you, right? My bug question is a question that's bugging me. like, should we just not have large events? I mean, and I don't even know what constitutes a large event now. Is a 100-person wedding a large event? Or we had a Jeezy concert here in Flint the other night. We had the Clark sisters at the Capitol Theater the other night. It's like, what's a large event anymore? And should we just not have them? Or should we have them in their ways to protect ourselves? And it just went dark, and that's either the devil or a bug. But yeah, so like, it's bugging me because I don't know what to say or what to do. What's a large event? What's not a large event? How many people should be coming together? How many shouldn't? What should we be doing to protect ourselves to ensure these bugs aren't being transmitted?
So Isaiah, I'm gonna say first and foremost, I know that we are talking about serious subjects, but you are funny. So I will say,
please don't encourage him, by the way. Please don't. I think you do this part. Please don't encourage him.
Hey, Carolyn and Marie Joy love me. They do. It's a thing.
You know, that's hilarious. So no, I will tell you this. It completely depends on multiple factors. I recently just put up a post on my page, and I was talking about the fact that a lot of this transmission occurs because of human behavior. So it's not really the bug itself that's really acting a fool, doing any more than what it would typically do. It's us that are acting fools in terms of not practicing prevention. And so what I mean by that is, for example, how you describe, okay, are we at a Jeezy event or 100 guest wedding? Let's think about that air exchange for one, right? So if we're in this closed in setting and the concentration of the air is thick and everybody's talking and there are no air exchanges, meaning that the inside air does not have within that heating, ventilation, and cooling system an ability to exchange air with the outside air. If there is no exchange that can possibly occur, then yes, there's going to be a concentration in the air of droplets, and it's going to increase the risk that if COVID is in that facility, then you're going to end up with COVID. Reason being, of course, if you have more people, then you're at risk for that. But I'm saying that to say that being at 100-person event with no air exchange may be worse than being at a 20,000 event where they have adequate air exchange. Because that means that people can be screaming, they can be yelling, they can be talking, even if we outside. Because think about it. I want us to go back to the whole George Floyd thing, and when all of the protests was going outside and people wasn't believing in COVID, even though COVID was real. It was like, how is it that all of these protesters don't have COVID and that there's no influx, right? Well, the thing is the air is moving even if we don't see it move. So we actually in hospital facilities, when someone comes in for, like, let's say tuberculosis or some sort of airborne illness, we do negative air exchanges and we exchange the air. We exchange the air with the outside air. So the air that's outside of the facility. So the chances of that person's germs going into the hallway or going into another person's room is going to be limited. So that's one of the factors, okay? The other factor is what other kind of protocols are in place, meaning at this wedding, you know, are there hand sanitizers everywhere? Are people expected, you know, to have to clean their hands coming inside of the facility? Are there temperature checks? Just as Dr. Deb mentioned, they were expected to have, you know, a negative COVID test as well as be vaccinated. So, okay, we can check off those boxes, but with where we are right now, we understand that we're about on our fifth dose of people having to get vaccinated in a year, less than a year, because December 21st gonna make like a year from the time that the first people started being vaccinated. So we have to assume at this point that we're still going through science and studies and that they may not be working as well as we thought they have, considering the amount of boosters that we have to give. And it's not to say don't get it. It's just saying that with us still understanding how things are going, what other preventative measures should really still be in place? And so this whole notion that if you are vaccinated, don't wear masks. I've seen people, because I'm vaccinated, they say, oh, I can stand near you because I'm vaccinated. It still doesn't mean that you cannot carry a viral load of germs in your nose or a viral load of germs in your mouth. Even if it's not going to make your system sick, you can still be capable of carrying it, right? So I always emphasize to people that when you're thinking about going to an event, I'm looking at the protocols, meaning hey, do they have any screening measures in place before I go? And this is whether I'm looking at a 100-person event or a 20,000-person event. So what are the screening measures that are in place? What is that HVAC system or that environmental system look like in order to be able to keep me safe? How stringent, meaning are these people really serious about it? Because Dr. Deb will tell you, she went on a trip and they had protocols in place, but how well do they abide by the protocols and make sure that they're following through? So you're looking at all of these factors to determine whether or not it makes for going to a good event, right? The other piece is that she mentioned that alcohol was involved. So that establishment in itself, or like, let's say that venue, how are they in terms of infection control practices? Is this somebody that literally has waiters or bartenders that are still taking the tip money and putting my lemon in my glass at the same time? Because that's money now and germs that are mixing, right? So we have to look at what does the overall picture look like, opposed to looking at, does this venue increase my risk or decrease my risk? I don't go inside of buildings, old buildings. If I have to, my mask is on. I got some sort of peroxide 50 with some water in a bottle so I can spray down the elevator if that's the only way up. So that way I can kill some of the germs or the droplets that will potentially be in the air from the last person that was on there. So we kind of have to think about the environments that we're in and if it provides like that type of environment where we can stay safe.
Repeat that mixture at the end. I'm taking all tips right now.
So a 50-50. So many don't know, but peroxide is a great agent. We actually use it in healthcare. We actually heat it up in healthcare. Do not heat it up at home because it is a chemical. Do not heat it up at home because it is a chemical. But if you mix peroxide with water, like a 50-50 mix, and you mist it into the air, it'll kill germs that are inside of the air. And so, and I recommend that because a lot of times we may be in a particular setting that we're unfamiliar with, but we know what it feels like to be inside of a thick air, right? Like we all know what that feels like. And so when you're in that thick air, you're saying to yourself, oh, you know what? This air could potentially be contaminated. So how do I make sure that I'm keeping myself safe?
No, first of all, I love that because we got holiday seasons coming up, and we're not talking about holiday season, but man, a whole bunch of people in the room. We know mask up, we know sanitizer or sanitize our hands, but man, this idea of spraying 50-50 mix peroxide and water, I'm taking that one I appreciate that one. I do have a question, and it's a serious question.
Mm-hmm.
And anyone can answer this. Maybe Dr. Knighton, if you start with this one because you kind of lifted it up, and then everyone can pick up. I like to coordinate, right? I got a blue sweatshirt on right now. I got my blue hat. I've got my pants got a little blue, and I like to coordinate. I like to dress. And in the last year and a half, year and 3/4, we've been attempting to coordinate everything, including these masks, right? You're starting to see. My wife does dresses. If anyone needs one, my wife does custom dresses. Just put that out there. Throw that in the chat somewhere. That needs to, But she's doing dresses with masks that coordinate with it. And many of those are cloth masks, right? They're not the medical masks. So if you can throw Gloria Miller's question up here. Really good question. My question is very different than hers, but I want to get both. My question is, how long are we going to have to do this? Like, should I just plan to coordinate all of my outfits with the mask? Because that's just the reality moving forward. COVID isn't going anywhere as we know it, and I need to coordinate my life around these cloth masks. And then the second part of that question is, are cloth masks protecting us in the ways that we thought or intended?
So for one, when we talk about his, and I'm going to go back to my original statement, all of these are preventative measures or risk lowering measures, right? And so I've always said that COVID is going to be with us for some time now. So if anybody is familiar with the Hong Kong flu emerged somewhere around 1965. And guess what? It just fell off the radar in 2017 as far as being untraceable. So if you do the math on that, literally we've had traces of the Hong Kong flu from the 60s up until around 2017. So I knew that COVID would be with us for some time now. Now, the thing is does it get to the point of where we continue to change our lifestyle around? What we have to become comfortable with is that infection prevention should be a part of our daily lifestyle anyway. It's a part of, if you're religious, it's in the Bible, right? So infection prevention, I'm telling you to wash your hands and cleanse yourself. So that's in there. So we know hand washing is in the Bible. And then even if you go beyond that, we think about the bubonic plague, what they had to do in order to be safe. When we think about any kind of thing, H1N1, which could have been a COVID, H1N1 could have been COVID, but it wasn't. We still had to clean our hands. And so we have to get comfortable with incorporating a lot of these practices into our daily lives. Now, when it comes to masks, traditionally with masks, you will wear masks if you were suspected of being sick, if you knew you were sick, to make sure that you were minimizing your risk of transmitting germs to others. That has changed in the midst of this pandemic because you and I both know that a lot of people are not honest about being sick. How many times have y'all heard somebody do that ain't a cough? Or they sneeze and tell you it's not a real sneeze. Or you got people that even got masks on right now where they cough and they sneeze and they say, I don't have to cover my mouth because I got a mask on. And so when we think about the behaviors of individuals just in general, you ask yourself, would I want to be in a situation of where I know that I'm at risk of acquiring COVID, but I'm not sure of everyone else's infection prevention practices around me? And so when we're talking about the cloth mask, the quality just in itself, it protects from some droplets coming in, just like it protects from some droplets coming out. It is no guarantee that any of this is 100%. The same way that you can breathe through it is the same way that droplets can travel through it. However, the expectation is just like if we were to spray if we were to take a spray and to put it on a curtain, right? You know that curtain is going to cover, like going to catch some of those droplets before it will reach the window if the window is on the other side. It's the similar thing where it protects you as a barrier to make sure that those droplets are not coming in contact directly with your eyes, mouth, and nose. And this is not something that we often talk about because it's like, oh, well, it's not going to protect me all the way. It's not going to protect me with this. But what if it was that one COVID droplet that could have got through that mask protected you from? And so we just have to kind of think about masks a little bit differently. A lot of people want a fix and they want a cure, but we have to remember that these are all risk-lowering measures.
Thank you so much, Dr. Debra. Dr. EJ, you have things to add?
I want to add just one thing because I do appreciate people with the wanting to coordinate, and I feel you, bro. So I actually went and I ordered right on Amazon. These are KN95 masks. I have a pack of the neutrals. This is white. This is black. This is gray. I'm going to open this one up in front of y'all. I agree with you. And I've had some questions and doubts about those. This is maroon, more black, pink, blue. I got all of it. I'm just saying, right? Like, I got it. And I realized if you actually make it out the house, and
you got Gucci,
huh?
I said you got Gucci.
I know, right? I'm like, hold on, let me see. Do I got my Prada mask? My point is, I got it. And if that's an expression for people, great. But it doesn't have to be cloth. Now literally, there's everything available. So if you want your mask to coordinate, go on Amazon and order a pack of masks in different colors. And just remember, you can't reuse them, right? So all these masks, and Dr. Knighton taught me this too. If you read on the back of the package, it will tell you how long that mask is good for. Some masks are only made to be worn for 4 hours. And some are made to be worn longer, but none of them should be worn day after day after day. They all should be started at the end of the day.
I think to some extent we need some historical context to realize a lot of the cloth mask wearing initially was because we had a shortage, right? We don't have a shortage anymore. So there's no reason not to protect yourself with whatever's available to you and the best that's available to you. I have a KN95 on at all times, at the very least. In the hospital or when I'm seeing patients, I have on an N95, usually with a face shield over it. If I'm seeing patients, and just in my regular spacing, I wear an N95 in the office. I think Dr. Knighton's point about air quality is super important. I have an air purifier in my office for that very reason, because people like to walk in your office sometimes with their mask down, right? My favorite is people who take their mask down to talk. That's not effective. The mask is supposed to prevent exactly that, right? That's not effective. So in answer to the question about how long we're going to be wearing masks, I'm with Dr. Knighton. I expected to be wearing masks now, and I expect to be wearing masks for the next couple of years, and wondered why we didn't keep mask wearing in certain areas, right? Like the people who make my food. I don't understand why they don't just wear masks all the time for forever. But we've seen a reduction in other respiratory illnesses, right? Like our flu season last year was not as terrible as it usually is. And some of that's because mask wearing, particularly when you're ill, particularly if you have, if you're feeling sick, it really does prevent illness. So I think we need to be thoughtful about that.
Well, I'm glad you're talking right now, Dr. EJ, because I guess I got a question that is probably directed at you, and then we can figure out if other folks want to jump in here. But we talk about mask wearing as one layer of protection, but the ultimate layer of protection that we were waiting on from the start of this all the way till now was this idea of vaccination. And I know Dr. Knighton talked about this earlier, but we talked about vaccination stopping or reducing COVID. But with these new variants, how will the vaccination stop or reduce these new variants if the vaccine doesn't present COVID infection and ultimate transmission? And so, at least the way I heard it from you all is that it's not doing that, at least not in the ways that we thought it would. So like, what is the vaccine's kind of, I don't want to say role, but how effective is it against these new strands, these new variants, this idea of the Omarion that we talked about earlier? Like, how do we fight the Omarion? Is it the vaccine, or is it something else? Is it some combination of things?
I think this is really important, and Dr. Knighton alluded to it, right? We can't expect that one thing is going to save us, right? We need to be doing multiple things. We need to be wearing masks. We need to be vaccinated. We need to continue to look for new therapies and have people who have COVID treated with antibody therapy. We need to do all of those things, make sure our airspace has great air quality, and make sure we're thinking about those things. When we talk about the vaccine, I think we have to be really clear. The vaccine has been incredibly effective, right? It's been more effective than as healthcare providers we could have expected or hoped for. And it has been really, really great. It's been game changing, and it's still really effective. We watched the vaccine be extremely effective against Delta variant and the original Alpha variant. And it's been incredibly effective. We know that for viruses, right? Viruses are going to evolve. We know that. This is not new for the coronavirus. It is expected that we are going to get variants. And I want to back up a little bit and talk about what a variant is. So we have the COVID virus, not a whole lot different than a lot of the other coronaviruses. It's a virus. It causes respiratory illness. Over time, the virus develops some changes in its structure, right? And some of that is it changes so that it can stick around, right? So you're a virus. You've infected multiple people. We call that hosts, right? A virus infects a host. You start to realize that you need to adapt because the virus isn't sticking around as long. The host is learning how to survive the virus. The host is learning how to not get as sick from the virus. The host is learning how to thrive and not really be as affected by the virus. And as long as that happens, the virus doesn't have as much opportunity to infect other hosts and to really stay around. Virus's main goal is to stay alive, right? And if we're trying to stay alive, we evolve. We adapt new mechanisms for how we stay alive. We get a little bit smarter. We learn how to evade treatments, right? And that's exactly what Omarion, the Omicron variant, has done. The Omicron variant has gotten a little bit smarter. And a lot of that is due to the fact that we still have significant spread of the virus at all, right? Remember, I said the virus can only live in a host. And so when we talk about getting as many people vaccinated, and that doesn't just mean in the US, it means across the country, across the world, getting as many people vaccinated as possible, we're talking about eliminating possible hosts for the virus, right? We're saying If you're vaccinated, there's a much lower chance that you're going to get the virus, which means that there's a much lower chance that the virus can spread to more people. And so our goal is to decrease the amount of people that the virus can spread to, decreasing the amount of potential hosts, which decreases the opportunity for the virus to evolve. Because again, if the virus can't infect you, it doesn't have an opportunity to get better at what it does.
So Isaiah, I want to add on to that too. I think a lot of people forget when we go back to the original emergency use authorization, what was the point of it? And the point of it was to reduce the clinically relevant symptoms and decrease the possibility of death. And so there was messaging in the media that it would prevent COVID, but that was never the intent. It was to make sure that we could decrease the heavy reliance that was on hospitals, which we know are already being burdened, right? So many people don't think about it, but literally, if we have 1 million hospital beds in the United States and we're outnumbered with 330 million people, even if less than 1% of that population got sick, not taking into account the existing congestive heart failure, diabetes, exacerbations, or, the different things that we may have going on, you already are at a deficit in regards to care. Like there's a shortage of care that can be provided. And so we wanted to make sure that people would be able to get this vaccine so that way they would be able to decrease their chances of severity of symptoms and death. And so that somehow got misconstrued for a lot of individuals of, oh, get vaccinated, stop wearing masks, get vaccinated, oh, we can stop environmental cleaning. I'm like, no. Why are we rolling back all of these things right now when it should all have been working in tandem together? And so that's one of the messages that I think constantly gets misconstrued, is that just because you have the vaccine doesn't mean that you can't transmit it. And just because you have it doesn't mean that you can't be infected. It just means that you may not be at risk of dying or having bad symptoms.
That kind of leads to maybe my most sincerely ignorant question. And so I'm going to ask you to bear with me here, Dr. Knighton. This Omicron thing, and this is sincere ignorance here. I don't get it completely. But what I've heard is that it has reportedly had milder symptoms, right? But then I've also heard that they tend to be symptoms that are more contagious. And so not if I'm maybe directionally accurate. So milder symptoms, but more contagious. One, I want to ask, what does that mean? Separate from that, I kind of want to understand if that is not better for us, right? We talked about herd immunity, getting more people get it, milder symptoms, more contagious, so more people get it faster, but they're not dying from it. Is this not what we were kind of hoping for, to spread this thing faster with milder symptoms, people don't die, more people get it? Or is this spike or this surge something that we should really be concerned about because we're not managing it appropriately? I guess I'm trying to combine all of these things that I've heard about the virus and how it should flow through community in order to provide protection. And then also, okay, people aren't dying from it. It's more like a cold, maybe a mild flu, not like a death thing. I don't completely understand. So what should I, as a layperson, no doctor in front or behind my name, what should I take from this?
So you should take from it continue prevention, meaning don't let up on your prevention practices. Stay vigilant on your hand hygiene practices. Wear masks where you don't know nobody. Wear masks where you do know somebody and you don't trust them all like that. And make sure that you know your status. I'm saying this to say that is the problem that we have right now, right? So there's all of this talk about what's a milder symptom, what's a more severe symptom. You don't know until it done already got you. But why do we have to get to that space of knowing that something is already bad once it's affected you? That's not where we should be. It should be, what can I do to prevent getting it? Not, oh, that Omicron variant, oh, that's just less severe, so I ain't got to worry about getting it. Well, that less severe thing, just how they say when, what they say, when white people get a cold and black people get pneumonia or black people get the flu. This is the same situation. You can think that it would take a lighter toll on your body, but it actually ends up doing a worser job on you because you're not taking into account the fact that your high blood pressure, your blood sugar, and all of these things may be affecting your ability to be able to recover. And unfortunately, for a lot of minority communities, we're not even aware of our chronic conditions. We're not even aware of what else is going on with our bodies. So what is health? And can we really say that we're healthy enough to say, oh, I can encounter that mild Omicron variant? And I tell individuals, we didn't know about flu variants every year, but yet you went to go get the annual flu vaccine, right? You didn't know about what strain we had. This particular time, they done went through the whole Greek alphabet, so now you alpha, beta, gamma, delta, epsilon, zeta, like, don't let me go there because I will.
Are you Greek? I heard that. Go ahead.
I know.
You already knew I was going to flow with it, but I'm going to leave it. But we, in terms of even having to go down that pathway, right? This ain't something that somebody has ever explored before of, oh, did y'all check out the flu strain for this year? So why are we so gung-ho about what we think we know about these strains based off of what media say? My thing is this: prevent it so you don't have to treat it. We know it wreaks havoc on kidneys. We know it wreaks havoc on liver, lungs, heart, whatever. Everything else, right? People can barely stand up. People can barely sit down. People got dialysis. It's all of these things that's happening right now. So if we're encountering all of these things that are going on based off of COVID-19, whether that was the alpha or beta variant, why would you even take the risk of Omicron variant for the media to come out and say something worse about it later on? Oh, it's got mild symptoms, but it give y'all cancer though. Did you know you got an increased risk of cancer? Why do we even want to play around like that? So prevent it so you don't have to treat it.
I appreciate
the idea. I love that comment about us not typically knowing this much detail about any medical therapy really ever, right? And this is a conversation I have with my patients in the office. You have reason to be, you have a lot of questions because you're seeing all of this detail play out in the media, or you have more access than you've typically had to this level of detail playing out. And that hasn't typically been the case. And I think it is important that we are armed with data and we are armed with resources. I just want you to have those discussions, as Dr. Knighton described, with your primary care physician or your trusted provider, so you can make those decisions in an informed way, right? You can parse through the data with them and really have your trusted healthcare provider help you make that decision.
I am going to, because I like to be, and I say this all the time, Dr. EJ, I like to be respectful of folks' time. It's been 43 minutes. I'm going to allow for just a round of you all sharing any pertinent information you think the listening audience might want to hear. And then we're going to jump off of here, because what I like, Dr. Knighton, is that when I call folks, they answer. And so if I keep you too long, you don't answer the phone when I call. So let's start with you, Dr. EJ, then we'll go Dr. Knighton, then we'll go Dr. Furr-Holden.
I think we are headed into the holidays, and I want to wish everyone a safe and happy holiday. Please remember that there are multiple ways to be careful. Wear your mask. Be thoughtful about the spaces that you're entering. Be thoughtful about opportunities to test before you enter large gatherings, and be safe. Thanks.
So I'm just going to give a couple of quick lessons here. When we're talking about mask wearing, make sure not only are you wearing your mask, but make sure you're wearing it correctly. Understand that your eyes, mouth, and nose are connected. So if you have it and you're wearing it as a chin girdle and it's beneath your nose or it's beneath your chin, just understand it's not really protecting anything. And also understand that the next time that you go to lift it back up over your nose and your mouth, you've now taken all of the contaminants from your neck and you've now moved it up to direct entry to your nose and your mouth. So it is important that if you are going to wear a mask or remove a mask, take it off. It's dusty, but you take it off from ear to ear. Make sure you take it off from ear to ear. How I mentioned before, if you're wearing it down here, all of those contaminants that were on your neck, then move up. So that would be my recommendation when it comes to that. Understand, if you are washing your hands, if you do not clean your hands correctly, it did not happen. Meaning, if you're not cleaning where the thumb meets the hands, if you are a young lady and you have, or older lady, and you have longer nails or artificial nails,
This
COVID
is
loves.
time out, Dr. Knighton. This is time out. This
Yes.
right here. This right here is the time out. Okay. So this mask right here, I just have to ask.
Is that a gator mask?
No. It's Central Michigan. Central Michigan.
No.
So-
She was asking if it was a neck gator. Like, is it one of those?
Oh, yes, it is.
And I hate them too. I see your face.
Get rid of that. Get
Yes.
rid of it. Throw it in the trash. It's only for decoration and only wear it at home. I want you to think about this. Come on, like,
Learn me something.
I just want to point out that you threw away a CMU mask and it ended up where it belonged.
So listen.
Oh, we're not talking about Heisman right now. Come on, let's keep on the topic.
So no, for one, they're thin. They don't protect against anything. That's actually the worst mask to wear. So any organization that's around infection prevention will tell you that that's not a good mask to wear. The thing about it is think about the activities that you partake when you put this mask on, right? You have to take it over your head. So it's resting beneath your neck. I want you to think about talking and all of those activities and where those droplets fall. Think about where all of the droplets fall to people that's going to interact with you. And then think about the fact that you now have to take your hands and pull it back up over your face with your hands in order for you to be able to protect yourself. You're putting the contaminants right near your face. Whereas if you have one of these masks, which don't have that up and down mentality, you are moving from ear to ear, which decreases your chances of being able to transmit germs. Gator masks are not recommended for that very reason. Think about how you have to grab them, how you have to take them off. I would tell anybody, regardless of mask, because I understand that maybe that's all somebody got right now. Make sure you're washing your hands before and after use, because that is one of the most important things. Also, too, going into what Dr. EJ said in regards to the holidays, I'm going to keep on bringing this up when you're talking about interacting with others. Make sure that you know where you're going. Make sure that you know who is there. Make sure that if there's food, buffet style food, pay attention to how that food is being distributed. If it is self-serve, are you all talking over the food? Is it at waist level height? Is it at chest level height? How is that going? Are people all touching the same spoons? Do you see the spoons laying over in the food? If so, just know that every hand is now on the very bagel or pastry or, I don't know, macaroni and cheese is in the macaroni and cheese. It's in whatever it is that you're getting ready to consume. So think about that as being a factor. If you're going out to a restaurant and eating, do not allow the waiter or waitress to talk over your food directly or over your drink. They may come to your table, they may take an order, but if they're talking directly over your food, they're spewing droplets over your food, and that's with or without a mask. Remember, a mask is only going to protect but so much. And just as I mentioned, when it comes down to those beverages, make sure that the person is handling, the bartender that's handling your beverage is not also handling the cash and the card at the same time. Because if they touch that plastic, which we know COVID loves plastic, we know money is dirty, dirtier than a toilet seat. They've now taken all of those contaminants and they've put it directly in your drink by way of your lemon or your lime. So just kind of think about some of those measures. I know it's too many to go through for the sake of time, but just start to think about ways that you can keep yourself safe. And also with your cell phone, make sure that you're at least cleaning it twice a day, because that is dirtier than a toilet seat. And we don't think about how many times it comes in contact with our face, our mask, and surfaces, and our hands. Thank you.
Wow. Dr. Debra, I'm sorry that you have to follow that, but give us your best.
Listen, I go on the radio with Dr. Knighton every day, so I've gotten used to it, but I'm better off because of it. I get sharpened by it. And the thing that I really love about Dr. Knighton is she has devoted her whole life's work. Her career is around how to prevent the spread of infection. So even before COVID, she was working on this. We all know a story of a loved one who went into a hospital for cancer and died of some hospital-borne infection that they contracted when they were in the hospital. So, you know, I just really salute her. And that's why I invited her to be here with us today, because I want to share with our community. She's just a rich wealth of information. So I'm not going to try to follow it. I will say this. Out of my own experience, the thing that I learned is this notion of prevention and risk mitigation. I talked to Dr. EJ a lot, and Dr. EJ don't go nowhere. Dr. EJ will surprise me and bring a bottle of wine. By the time I know it's here, she is already pulling out of my community. And I keep my front door open. Dr. EJ will put the wine on the front porch. She don't ring the doorbell. She don't knock on the door. She gets back in her car, and then she texts me when she's out of my community, say, hey, I left a little something for you on the porch, right? And I said, Dr. EJ, why? And she said, because I have 2 young children at home who aren't vaccine eligible yet. And me and my family have decided until they're vaccine eligible, we're just going to, you know, limit our interaction with people outside of the man. You know, she's a physician, so she's in the hospital, but she honors those, you know, protocols and all that. But we're just not socializing until I know that I can get the kids protected. If you think about it on a continuum, I think about my own experience. I did really good up until the reception. And like Dr. Knighton said, the alcohol comes out and the behavior starts to shift. And then when I got home, I didn't take the little extra step to say, because you knew that you were unmasked and on the dance floor and some of these things, you now need to just quarantine for a few days and go ahead and take advantage of one of these really great rapid community testing sites just to make sure you're negative. I was quoted as saying, if I had to do all over again, I would have sent a nice gift and a handwritten card. And that's true, because at the end, not knowing if I had infected my granddaughter or not, there's no event to me that would if I weigh it out, that I think would be worth that. So I just encourage people, be thinking about the long range, because people ask me all the time, Doc, when is this going to end? And I hate to tell people, there's no big bang that's coming. We got too many people heels dug in as a heck no to get vaccinated. Nothing magical is going to happen. This will end when we figure out how to live with it and how to have it stop dominating our lives.
Oh, we need to quote that.
So I'll say this before we close out. I'll say this. One, I acknowledge the time before, that way anything over was your fault, and so you still have to take my calls when I call you. So just point out that I was clear that we were closing in, and you all decided to talk a little longer and drop all of these nuggets, Dr. Knighton, and so you still got to take my calls. I'm also pretty excited that I know a nurse scientist that studies infection prevention. I've added to my list of resources an amazing person. And so, and I guess before I close out completely, I do want to say that it is an honor, and I mean this seriously. It's an honor to be on the call or on Zoom. Our old world would be on the call, right? But on Zoom, not only learning, but benefiting from the lived and professional experiences of 3 African-American women. You all are amazing, doing amazing work, and I appreciate you. I'm going to close by saying just thank you for the time, because it's because of opportunities like this, a quick hour in the evening after everyone's gone home, and you all have already done the jobs that you get paid for. Giving this time and talent to our community allows people to make the best decisions for their family, for them and their families, based off of information that's credible from Michigan State University, Johns Hopkins, Case Western, right? We're not talking about some BS schools here. Even though we did put Michigan State in there, we are not talking about BS schools here.
How long you had that behind the scenes?
That was coming.
That was deep down.
He can't help it. He can't.
But I appreciate you all. I'm not going to make this any longer because I know we're going to have to do something else before the holidays. Dr. Knighton, you are in the rotation. I want to tell you this now before we close out. My middle name is Maurice, and I'm from Flint, Michigan. And I just have to acknowledge that I love Carolyn, and I don't know if you know this, Dr. Carolyn is amazing. She's down here in the corner. And Dr. Marie Joy, up here in this far right corner for me, is also amazing. And now we've got a Dr. Camille live from Euclid, and we love her, and we're thankful for you joining us. And so everyone, thanks for being here. We appreciate you. We will be back to do some other holiday stuff. And so looking forward to seeing you all again. You can close us out, Doc.
Awesome. Thank you.